Hi friends, welcome to my YouTube channel. We are discussing community health nursing previous questions. Next question is infection in early pregnancy may result in options are A. Does not affect the fetus. B. Congenital defects and including death of the fetus. C. Growth retardation of the fetus. D. Death of the mother. Correct answer congenital defects and including death of the fetus. The virus can cross the placenta, that is called vertical transmission, and infect the fetus in utero. Question number 13. If the newborn baby has IgM rubella antibodies shortly after birth, it indicates options are A. Congenital rubella syndrome, B. Congenital defects, C. Teratogenicity, D. Cardiac malformation. Correct answer option A. Congenital rubella syndrome, as IgM antibodies do not cross the placenta. Their presence indicate that they must have been synthesized by the infant in utero. Question number 14. The classic triad of congenital defects in congenital rubella syndrome are options are otitis media, epilepsy and glaucoma, retinopathy, microcephaly and deafness, cardiac malformation and cataract, deafness, encephalitis and blindness. Correct option deafness, cardiac malformation and cataracts. Other options are resulting defects, glaucoma, retinopathy, microcephaly, IUGR, cerebral palsy, etc. Question number 15. Which vaccine is administered for preventing rubella? Correct answer RA27/3 in a single dose of 0.5 ml subcutaneously. Question number 16. Question number 16. A contraindication to rubella vaccination in pregnancy. The recipients of the vaccine should be advised not to become pregnant over the next 3 months. Question number 17. The period of maximum infectivity in mumps is just before and at the onset of parotitis. Once the swelling of the glands has subsided, the case may be regarded as no longer. Question number 18. In case of mumps, the presence of maternal antibodies will provide immunity up to the age of options are 1 year, 4 months, 10 months, 6 months. Correct answer option D, 6 months. Question number 19. Major reservoir of influenza virus is options are animals and birds, human beings, soil and decaying materials, rodents. Correct answer animals and birds. Question number 20. A rare and severe complication of type B influenza is options are A. Purulent bronchitis, B. Otitis media, C. Reye syndrome, D. Pneumonia. Correct answer Reye syndrome. Reye syndrome is a fatty liver with encephalopathy. Frequent complications are acute sinusitis, purulent bronchitis, otitis media and pneumonia. Question number 21. The live attenuated influenza vaccine is administered as options are A. 2 doses as IM injection, B. Single dose as intranasal spray, C. Single dose as subcutaneous injection, D. 3 doses as oral solution. Correct answer option B. Single dose as intranasal spray. Live attenuated influenza vaccine is a trivalent vaccine, but killed vaccine is administered by the subcutaneous or intramuscular route. Question number 22. Avian influenza viruses that primarily affect birds are options A. H5N1, option B. H2N2, option C. H3N2, option D. H1N1. Correct answer option A. H5N1. H2N2, H3N2, H1N1 are species affecting human being. Question number 23. Incubation period of influenza A H1N1. Options are 1 week, 4 to 7 week, 1 day, 2 to 3 days. Correct answer option D, 2 to 3 days. Question number 24. Drug of choice for treatment and chemoprophylaxis of influenza is? Options are A. Rimonabtadine, B. Zanamivir, C. Oseltamivir, D. Amantadine. Correct answer C. Oseltamivir. For adults, the recommended oral dose is 75 mg twice daily for 5 days. Zanamivir is an alternative antiviral drug if oseltamivir is not available or not possible to use, or if the virus is resistant to oseltamivir, virus is resistant to the M2 inhibitors, example rimonabtadine and amantadine. Question number 25. A thick blue, white to grey, black pseudo membrane that may cover posterior pharynx or the entire tonsils may spread to cover the soft and hard parts is present in. Options are measles, mumps, diphtheria, tuberculosis. Correct answer is option C, diphtheria. Hope everybody understood. Please subscribe and support me. Watch all the videos. A lot of previous questions was included. Thank you.